the interest of time, we're going to move ahead to the second speaker. So this is Dr. Antoine Ribieras, who will be speaking on gangrene, revascularization, and limb function improved with E-selectin adeno-associated virus gene therapy from the University of Miami. Dr. Ribieras.
Hi, everybody. My name is Antoine. Thank you so much for the opportunity to speak with you today. So just very briefly, I'll be discussing a novel gene therapy that we developed in our lab based on the E-selectin, which is a cell adhesion molecule important for neovascularization. And we tested this gene therapy construct in a mouse model of hind limb gangrene. So just some very brief background. Up to about 12% of patients with peripheral arterial disease suffer from chronic limb-threatening ischemia, which is the most severe form of PAD and is associated with significant morbidity and mortality. While surgical revascularization is the mainstay of treatment for these patients, unfortunately, up to 30% of them are either not candidates for or they have failed prior revascularization attempts. And so for these patients, we've been working on novel methods for improving perfusion to ischemic limbs. Like I briefly mentioned, E-selectin is a cell adhesion molecule, and it is its expression is induced by ischemia and tissue injury on endothelial cells. And via expression of E-selectin, the endothelium is able to recruit leukocytes and, importantly, endothelial progenitor cells to areas of ischemia and wound healing. And in this way, these endothelial progenitor cells are able to participate in neovascularization. So our overarching goal has been to increase the tissue levels of E-selectin to basically improve recruitment of endothelial progenitor cells and hopefully improve perfusion to the ischemic limb. And this is briefly our experimental protocol. We used FBB mice, which are sort of have an intermediate susceptibility to ischemia. We treat the mice with either E-selectin AAV29 or LAC-Z AAV29 as control. The vector we're using is an adeno-associated virus vector, which has a good track record of safety in other therapeutic applications. And the gene therapy is administered 4 and 2 days before surgery and on the day of surgery. To induce ischemia, we perform femoral artery ligation at the 2 sites shown in the image on the right. And in addition, we administer L-NAME, which is a nitric oxide synthase inhibitor. This further increases oxidative stress in the limb and induces gangrenous changes in the footpad of these mice. So the first outcome we look at is just the gross appearance of the foot, in which we can score based on the Faber hind limb ischemia score, with some examples there shown on the left. And basically you can see by post-op day 7 and certainly by post-op day 14, the mean Faber scores are lower in the E-selectin treated mice, basically demonstrating that they have reduced severity of tissue loss. Like many other studies of hind limb ischemia, we assess reperfusion to the footpad post-op day 7, post-op day 14, and similarly, we can see that perfusion is improved in the E-selectin treated mice with a significant difference 2 weeks after surgery. This slide demonstrates another technique whereby we can look at the microvasculature in the footpad. This is dye perfusion with the fluorescent dye eye. We perform this again 2 weeks after surgery. It's via intracardiac perfusion, and then we harvest the feet. On the left, the 2 left images are unligated or non-ischemic feet, so normal feet. And then the 2 images in the middle demonstrate a LAC-Z mouse on the left compared to an E-selectin treated mouse on the right. And you can see in that image improved reperfusion of the footpad, which is quantified in the graph on the right. So then we harvest the muscle again at the same time point 2 weeks after surgery and do some histological analysis. So this here is just demonstrating E-selectin expression in the local vasculature. So in the top larger image, this is a co-staining for CD31, an endothelial cell marker, as well as E-selectin. You can see E-selectin expression specifically in those endothelial cells. Whereas in the LAC-Z treated muscle at the lower image, we see some CD31 expression, but no real E-selectin positivity. Then histologically, these are two images of just H&E staining, demonstrating overall the myofiber size is larger in the E-selectin treated mice, and also the morphology. The nuclei tend to remain at the periphery, which is what's observed in normal muscle, versus the centrally located nuclei in the lac-Z treated mice, just demonstrating basically more ischemic damage. And again, those are quantified in the middle. And then for functional testing, we train the mice pre-op to run on the treadmill, and then have them exercise post-operatively. And the E-selectin treated mice generally perform better on this testing. So as I mentioned at the beginning, the primary mechanism we believe this therapy works is by enhanced recruitment of endothelial progenitor cells to the areas of ischemia. And so here we performed staining for CD34 and CD31. CD34 is a marker of early endothelial progenitor cells, and we can see some co-localization of those signals in the E-selectin treated muscle, whereas there's much fewer CD34 positivity in the lac-Z muscle. And then finally, just looking at any potential effects on inflammation, toxicity. E-selectin is involved in recruitment of leukocytes, and so we wanted to see whether it significantly affected inflammation in the ischemic muscle. And this is staining for MAC2, marker of macrophages, and we actually didn't observe any real significant infiltration of macrophages in either treatment groups. And then finally, E-selectin is also prothrombotic, and so we wanted to assess whether it was having a significant effect on coagulopathy. So we just measured serum D-dimer levels and did not find any significant difference between the E-selectin and lac-Z treated mice. And this final slide is just some very preliminary biosafety data looking at hepatic and renal function between E-selectin, lac-Z, and PBS treatments. There was no real difference between either of those. So in summary, in this preclinical mouse model of hindlimb gangrene, we've shown that E-selectin AAV29 gene therapy can reduce the severity of tissue loss and skeletal muscle atrophy. It thereby improves recovery of hindlimb perfusion and function. And we believe this is working primarily through enhanced recruitment of endothelial progenitor cells. And just with some preliminary data, it does not appear to have any significant pro-inflammatory or pro-thrombotic effects or systemic toxicity. Thank you, and I'm happy to take any questions if there's time.
So Dr. Ribieras,
yes.
One of the issues with gene therapy that works in mice but doesn't always work in humans is that all the mouse models tend to be these acute ischemia models. Do you think that this therapy is going to be translatable to patients with long-established chronic PAD?
Yeah, absolutely. That's definitely a concern. And it's something we're testing in the lab, whether we can, of course, these models aren't directly translatable, but in the FEV model, the gangrene tends to develop over a period of 2 to 3 weeks, sort of subacutely. We're testing whether we can administer therapy after induction of ischemia and whether that still helps with reperfusion and the severity of gangrene. And then compared to other past clinical trials, those have generally used naked plasmids, which generally have poor uptake into the cells, poor efficiency of expression of that protein. So by using this vector, we hope we can really get high-level expression of E-selectin and longer-lasting effect.
So Dr. Glevitsky has a question about the fact that you ligate the femoral vein in addition to the artery in your model, because then it makes it look more like phlegmasia as opposed to a strict arterial ischemia like in humans.
Yeah, absolutely. This is the way we've been doing it in the lab. I agree, it's not strictly a femoral, not strictly an ischemia model, and there's definitely some component of vascular congestion. We do it for the ease of the operation, and then histologically, we haven't really observed any significant evidence of thrombosis, and don't think it's really contributing. But I agree, when we could try to test it just with femoral artery ligation, absolutely.
Yeah, because multiple other groups have done just plain femoral artery ligation.
Absolutely.
It's not that technically challenging.
Yeah,
So
yeah,
I would encourage
course.
you to do that.